Hello, good morning. This is Kate Birch, and today is Monday, April 27th, and this is our very first live presentation to our FHCi membership beyond our board members and our practitioners. So welcome everybody, and a few little details about how we're going to work this. Both Sarah and Ursula are managing the chat room, and there will be some slides that will have question marks on them, and those slides will be after a segment has been presented. And if there's questions that Sarah and Ursula haven't answered just privately in the chat that everybody can read, then there will be a time for questions to be added or spoken orally at that time. So we've got about an hour. I want to just dive right in. We've got a lot of information to share. For those of you who are new to Free and Healthy Children International, we have been in existence since 2011, and 2013 is when we became a 501c3. We are dedicated to research, education, and access to HP. And our model of operation is really a model of service to the families and children. So this is like the first time we've set up a number of networks within the organization where we actually have a direct delivery to our families from the board. So this is coming from the board. We are operating as if we are a private membership association. Our practitioners have membership to the pharmacy that supplies the HP kits, and now with the CV research, the Novus-CV. We also provide membership to our supervisors and membership to our families, and so we're operating outside of or under the constitutional right of freedom to assembly and private assembly. We can talk more about that soon. And in accordance to that, this lecture is intended to be held in private for our membership platform. Means there will be a recording and you can share with your friends and family. But given a lot of the information that is presented, there's a threshold or capacity upon where it may not be advisable to share. So this presentation, we're going to really look at what infectious disease is collectively and individually, and looking at public health care models in relationship to conventional medicine, that's with vaccination and antibiotics, or in homeopathy, we have two models. One is the genus epidemicus and the other is homeoprophylaxis. And then we're going to look at what happened in Cuba. And then looking at what FHCi does and issues with the FDA regulation of homeopathic remedies, a little bit more about our membership platform, some of the results from our past general HP programs. So some of those listening are new to FHCi. They just came in with the CV research. And others were already existing families that some of them participated in the general HP research. And so I want to present both sides. And this is the question box. You'll see along the way, after I get through each section, there will be time for questions on that. And for those who want to learn more about Parent's Guide to Educating Your Child's Immune System, the solution book is the way to go. And currently it's on sale on Amazon. It's about 20% off, so it will, through the end of the week, be on sale. And then looking forward to what our public outreach for 2020 is. So we're going to start with infectious disease. And this philosophy comes from homeopathy, and it's in line with other holistic systems. So we understand that pathogens and humans have coexisted and co-evolved for eons, and that these pathogens actually facilitate some evolution And contagion is based upon susceptibility. Susceptibility is what we work with homeopathy and homeoprophylaxis. Epidemics are based on collective susceptibility. So when you have a group of people succumbing to the same disease, it means that there's something within that collective that is allowing that to happen. And whereas Western medicine is focusing on trying to target what the infectious agent is and get rid of that, homeopathy and homeoprophylaxis is all focused on what is the susceptibility of the person who may or may not contract the disease. These pathogens can serve as pressure release valves for the human population or the human individual. And infectious disease models, infectious disease prevention models must be coordinated to understand the pressures of society. So what is happening today, right now, with coronavirus or COVID-19 that is showing us? These are questions that are we may not necessarily answer in this presentation, but this is a question to ask. So one of the organon of medicine is the foundational work of Dr. Samuel Hahnemann, who developed the system of homeopathy. And these paragraphs 34 to 40, he talks about infectious disease and dissimilar and similar disease. And the first precept is that a healthy individual will repel the disease, means that they won't contract it, and the disease will go away and they'll be fine. The second precept is that the person may contract the disease, and they will have an immune system process that will facilitate elimination of that disease, and their original state of health, which is this purple halo, will return to how it was before. Just a little bit of insight into how infectious disease works in the body is that all of our surface membranes, mucous membranes, are activated upon exposure to disease. And these mucous membranes activate what's called the T1 response, which is the general immune response, which is fever, chill, discharge, sweat, body aches, and things like that. And please, as I'm talking, think about, if for those of you who've taken the CV Nosode or have other experience with HP or just the last time you got sick, to put this into context of your own life. And then the second part of the immune system, and these two work together in balance, is the T2 response, which is the allergic or antibody response. And then the T1 response is for the initial activation of the immune system, white blood cells, but also elimination pathways are set up, means how am I going to discharge this disease, whether it's through mucus, eruptions, sweat, diarrhea, vomiting, bleeding, anything like that, right? So we also have this concept of a circle of disease, and that once you've been exposed, there's a prodromal period. It sets up a chill and a fever, and the fever in turn stimulates the antibodies to be produced, and the discharge is there, and usually resolution occurs with a sweat. So the last time you were sick, maybe you remember waking up in a sweat one night and knowing that, oh my goodness, this is over. The strength of the individual's immune system dictates how they move through this circular process. And in some instances, somebody can get stuck either over here in the chill, they still chill, or they're stuck here because they're not making enough fever, or the fever goes too high, or they get stuck here in allergic response, or 3 or 4 months later they're still having mucus discharge. It's all about the strength of the individual to move completely through this immune process. So what we want to say is that this acute process or fever is a short-lived manifestation of the struggle between the ego, which is the individual's thinking, and the reality of the hereditary or external reality. So the forces of hereditary. So if you have a weak constitution, you may not be able to reconcile how it is that your ego perceives life, Or the same is if you've been living outside of the rules of nature, the laws of nature, and that is defying reality, so overextending yourself, eating poisonous foods, poisoning the ground, abusing people, so on and so forth, that at some point reality will come in and balance that out. And an acute disease is that process, and it needs to be listened to and worked through. We can also say this action of infectious disease in the general population. So here we have a bell curve. This is, if you take a circle and break it out on a line, this could also be the prodrome, chill, fever, antibody, discharge, resolution, sweat. It's along the same thing. And right in the middle there, there's a shift that happens in the individual. Or we could also see it in a culture, or, you know, in what we're seeing with COVID as it's moving around the world. We are moving through, and some places move through it quicker and others. And the key point here is that something has to give. Something changes in order for this bell curve to start on the decline. And whether that's like in cholera epidemics, they need to clean up the sewer from the water. In COVID, you know, a lot of people are talking about how we've been damaging the earth, and isn't it great that we go inside? And so what are these pieces that have to happen there? And along the way, if you subscribe to Western medicine and you're given fevers, fever suppressors, antibiotics, steroids, immune system suppressors, any of these things, it's not going to move through this process. So now we recognize there are collective susceptibilities. We are in a collective disease state, and it's going to require collective evolution to move through. And what we can say we're doing with HP is the creation of a posidemic, and I'm just going to overlay this on here. So those of you who've taken the CV Nosode are changing the field. Now this is really important. What we're doing is actively stepping into the struggle of the disease and speeding up the evolution of this collective process by reconciling those pieces within ourselves. So just to continue on with the strength of disease versus susceptibility, there are those individuals that have a weak constitution or have a history of suppressive medicine, and instead of resolving the disease now gravitates to the organ of affinity. And so some of the cases that we've seen with CV is, yeah, they get a cold, a runny nose, a little fever, and they feel better. And then other ones, they're going into whatever the weak link is on that person. If they have high blood pressure, the blood pressure gets worse. If they have kidney damage, the kidney damage gets worse. If they have asthma or respiratory history of pneumonia, the lungs get worse, and so on and so forth. And that fits exactly in this model. And the Organon of Medicine was written in the early 1800s or late 1700s. So what is true then is true now. We can still see it, and these are the foundations that homeopathy is based on. And so we just now, let's just see, are going to look at the difference between vaccination and homeoprophylaxis in relationship to what we had just talked about. So vaccination is not only the infectious agent, but it's also all the other toxins that are held in that vaccine. And it's also forced into children when their immune systems are not developed enough to, one, process the infectious disease, but two, liberate the toxins that are also in the vaccines. And plus, it violates the normal oral route of infectious disease, which would activate the peripheral surface membranes to activate the general response Here is just injected and bypassed, and so what that means also is the eliminatory route is not open because it's the fever that activates the eliminatory route. And so what we can say with homeoprophylaxis, it's a willing participation to step into the infectious process. Means you want to open up this immune response, the fever, the discharge, the elimination pathways, and it's only through opening that up do you actually get the stimulation and adaptability of the immune system and improved immunological health. And we call it immune system education and less disease exposure. So note there is a question box here, so I'm going to break after this slide to take any questions. So with our vaccine paradigm, what we have now are many circulating injected diseases in the bloodstream, incomplete expression of the disease to the organ of affinity, agitated immune response and histamine reaction from the adjuvants, and also toxicity there, and damage to blood cells as the immune system is trying to process this out. The immune system then also gets inability to differentiate what's foreign or not because the peripheral membranes were never activated, and the infectious disease is injected in, and the body is like, well, is this supposed to be here or not supposed to be here? And autoimmune disorders and ear infections, and then they treat with antibiotics, and then you get, dysbiosis from that. So Ursula or Sarah, are there any questions right now that need to be addressed?
I think what would be helpful is if you could talk a little bit about why some kids do actually have the disease that need to be processed and some apparently have no reactions.
Yep, we're going to get to that slide. What else?
Somebody wanted a little more information about the solution book, which we answered. So the last one on Amazon, it's called The Solution, written by Kate Birch and Silver Rothkopf. And somebody's asking more about what the child found access to the COVID Nosode.
Yeah, we'll carry on. Yeah. Okay, good. So now we're going to look at.
There's another question.
Okay. Then you get internal inflammation, and depending on what the disease that's been entered in, so hepatitis B goes into the liver and starts changing the genetic and detox expression. DPT, those are all neurotoxins. They go into the brain and cause cerebral inflammation, tics, learning disorders, high-pitched screaming, like that. Meningitis or MMR produces inflammation of the meninges or intestinal tract. So each one of these diseases, based on the actual nature of the disease, will go to the, if it's not allowed to, like measles is an eruptive disease, it needs to come to the surface and erupt. And if it's not doing that, then it erupts internally like that. Okay, so we have two models in homeopathy. We have the genus epidemicus model, which Samuel Hahnemann developed in the 1800s as he was practicing homeopathy. The first epidemic he worked with was scarlet fever in Paris, and the main remedy for that was belladonna. And all of these epidemics, he worked with typhus in 1813, comparing allopathic and homeopathic treatment. This is sourced from Julian Winston. These are all using genus epidemicus. And what that means is that when you have an infectious disease that's affecting a group of people, there is an immune response that group of people will present, which is very similar. Means they all have the same symptoms. Means that there will be 1, 2, or 3 remedies, or maybe 4, that will match those symptoms. And if you give that to everybody, even the people who aren't sick, it will help the people who are sick, but it also will help the not sick people to prevent, because that collective susceptibility of people, that they will still present their response to the disease in the same way, right? So the cholera remedies are cuprum, camphor, and veratrum. Different epidemics, yellow fever epidemics, diphtheria, again, all in the Spanish flu, that was the 1918. So the success rate of homeopathy is way outfolds the conventional treatment at the time. People will argue that conventional treatment has improved these days, but we can still say that there's a pretty good success rate with allopathic method. So HP, or homeoprophylaxis, we are using disease nosodes specific to the disease. So when you have a genus epidemicus, it may be that this group of people will take that remedy and this group of people take this remedy, and maybe even within the same family, one or other might need different remedies. And the limitations to that is, first of all, in order to determine the genus epidemicus, it takes a fair amount of time, and a lot of people have to get sick to do that. Then you need to analyze and individualize, and then you also need a delivery system that can reach a large amount of people at the same time. So I was invited to a conference in Cuba in 2008 and learned about the use of leptospirosis, and they did 2.3 million people in a very short amount of time. And we'll get to that in 1 minute. When you're using the nosode, you don't have the initial time, you don't need to individualize, and you can just go ahead and give it, and it's simple and a rapid application if you have a delivery response system such as what FHCi has established with our HP supervisors, and families can directly contact them, and there's a whole lot more development that can happen with that. So the theory of HP, that's the use of nosodes, it's the introduction of infectious agent or disease agent into immune systems prior to exposure. It addresses the susceptibility of the individual towards that disease, such as pertussin for whooping cough, or the collective if there is a collective disease expression. The nosode is intended to elicit an elimination route, so that is an immune response. And then what happens, and we'll see with the leptospirosis, is that when enough people have done it, it actually changes the field upon which we are all living in, and so changes the infectious disease incidence or the susceptibility of people. So homeopathic nosodes are made through the dilution process that all homeopathic remedies are made from. It's a pure disease agent. There is no other particles in there. It is usually sourced from the sputum or discharge of an active case. And so not only do you have the pure disease agent, but you also have what would be the normal healthy immune response to that disease. So when it's potentized, what's left in the substance is an energetic frequency, not only of the disease, but also the normal human response to that disease. So it's a little information packet that when you take that, your body says, oh, this is how I need to respond to this disease to eliminate. Body behaves as if it has a disease, but there's no disease in the remedy. It's not possible to be contagious. You're just eliminating or doing an elimination process. The frequency passes out of the body and you get the learning of the disease without the suffering. And so here is the leptospirosis model. There were 3 provinces that were given the doses, and they were first given in 2007 here and 2008. Let me see. So the black line is, no, they were given in 2007 here, and this is 2008 here. The black line is the treated province, and the blue dotted line is the rest of the country. And so they were able to, there's hurricanes that move through Cuba in the fall, October, November every year, and they had been following the trajectory of leptospirosis, and the provinces on the eastern side get hit the worst with the hurricane. So leptospirosis incidence increases with hurricanes because there's flooding and it's a spirochete in the floodwaters and it gets in people's skin. So they did the first intervention with a 200 in 2007, 2 weeks before leptospirosis. And based on the trajectory, the dotted line is the predicted outcome, but this was the actual outcome. But the rest of the island continued to increase in trajectory. And in 2008, they did a 10M potency right before, and there was absolutely, it had dropped down to 4 suspected cases, and there was still 150 or so in the rest of the island. And now what's not on this slide is in the subsequent years, in both the treated and the non-treated portions of the country, the leptospirosis cases were down to 0, under 10. And so what that shows is that by treating one group of the population, it will affect the whole rest of the population. And this is just a short graph of what they've been doing, but they've been studying leptospirosis for 20 years, and every year it was getting incrementally worse. So the fact that 2 or 3 years later, after this, the leptospirosis incidence remained low for the entire country, and previously they also had Nosode, which is a vaccine, the trajectory was still going up, so the vaccine wasn't helping. So what we're doing with homeoprophylaxis, and some of you maybe already understand this just by nature, and that's why you found us and that's why you came to HP, is understanding that it's holistic, that our bodies work in symbiosis with nature. There's a long-term outcome with homeoprophylaxis, which is improved health. And we have a comprehensive understanding of infectious disease and the way the immune system works in relationship to infectious disease. With HP, we are not primarily preventing disease, we are educating the immune system so that there is individual evolution and societal evolution, and this is based on the idea that infectious disease actually serves as an evolutionary pathway. And if we can step into that prior to the disease coming along, we're able to capture the benefits without the suffering. What's going out is a fear-based model, which is running rampant these days. It's looking for short-term fixes. So you give all these vaccines to infants, and now you've delayed childhood infectious diseases to be happening in teenage years or young adulthood when the antibodies that are forced from the vaccines wear off. There's an incomplete understanding of how infectious disease works in the system, and also what is normal function. So it's normal to get a fever after a vaccine, but they say take Tylenol to stop that fever, and then you get all the side effects. So the infectious model that vaccines operate on is not quite complete. It ends up creating more diseases and is anti-evolutionary. It's decompressing the immune system and so on and so forth. So this slide is again open for questions. One of our reasons for doing this presentation is I know you've all had relationships with your practitioners, and 2020 is about outreach, and what we found even through the CV registration research process is that friends of friends that want to come in with the research are just beginning to understand these holistic concepts. But then you might find, like talking with your neighbor or your in-laws or even your family, that they are still very much operating from the fear-based model. And, how do we create the language? And this is a question for you guys. How do we create the language to facilitate so we can begin to speak the same common language? So any questions right now? Ursula, Sarah?
Yeah, there was one question back to the leptospirosis. I think Sarah actually answered that. How the HP was responsible for
because they had been doing the vaccinations for about 10 or 15 years, and you could see from that chart the trajectory was still increasing. And then they did another study where they showed, was comparing in mice, laboratory mice, the use of the Nosode and the Vaccination, which was the vaccine. So in that instance, the 100% of the mice were given injected with the, well, let's see. The first group is they're all injected with the disease, or first injected with the Vaccination and then injected with the disease. And they had 100% survival rate and 100% made antibodies. And then the HP group, they did first the HP prevention, and then they injected with the disease, and then 80% survived and 20% died, but none produced antibodies. So what this morphogenetic field phenomena is what is activated by the general immune system. And also this study didn't say what the long-term health outcomes were of the mice that were injected with the vaccine, because we know how it changes, and it also doesn't say what the ingredients are in the vaccine. So did these mice develop tumors or cancer or other things like that? And also, was the HP outcome, were they still happy, healthy mice? And I can say that they probably were based on our HP results, which we're going to look at shortly. Yep, so carry on. Other questions?
The question was, in Cuba, what percentage of the population did receive HP Nosode?
It was 2.3 million people in those 3 provinces, and I don't know the entire population of Cuba, but I would say there's 20 provinces in Cuba. If it's evenly distributed throughout the island, it would be 3 out of 20. What is that? 1.5%. Yeah.
Is the health officials in Cuba acknowledged that it was HP that made the difference?
Yes, so the Cuban model is the government recognizes homeopathy. There's the Finlay Institute, which is a WHO vaccine manufacturer, has this amazing research guy, Gustavo Bracco, who worked for them, who also worked in vaccine production, but they saw some results with meningitis in South America, and they started making a meningitis nosode, and they used not only leptospirosis, they did HP with hepatitis, viral conjunctivitis, other infectious diseases that were going around the island. So the Ministry of Health itself endorsed homeopathy and HP as a part of a separate branch of the Finlay Institute. And the way that they were able to deliver these remedies so quickly is that they potentized the remedy in the laboratory, and then it was driven out to the villages and the communities in large gallons, and then anointed onto sugar locally, and then distributed into very quickly. It took them, a week to distribute to that many people. And also the Cubans themselves trust their medical system, and so they voluntarily came and lined up and took the remedy. And it's just because the effort, it was coordinated from the central government to the vaccine manufacturer that made the HP Nosode, to the local doctors and clinics, into the community, that this is how they delivered their vaccine system, but they knew the results were phenomenal with the HP. Yeah. Other question there?
One last question from the chat. What percentage of HP, or what percentage of the population would need to participate in HP to facilitate the paradigm shift?
Yes, it's a big question. We don't know. Just one other example where we've seen this paradigm shift is with kids in orphanages in Africa with malaria. So there's Emma Resonance Healing Foundation. They are an affiliate organization. They're listed on our website. Is that they have been doing remedies for malaria and AIDS and war trauma and different things like that in Africa. and they did one clinic or one orphanage. There were 600 children, and they all gave them the malaria nosode, and they checked the records that year. And in the surrounding community, so they came back and there was virtually no cases. I don't have the exact number, but the malaria incidence had really gone down in the orphanage. But in the surrounding area, there was an increase in incidence, and it had been a very heavy rain season. And then they came back the following year. They continued with, pre-seasonal HP just in the orphanage. And the following year, even though it had been a rainy season, the incidence remained low in the orphanage, but now the surrounding villages also had low incidence. So whatever the wave is, it depends. And there's also different potencies work at different wavelengths. So we chose the 1M for different reasons in our research. There are other, like the homeopaths, we've taken the 10M, and there's some people who have been potentizing it up to a higher potency frequency. And this is actually allowing the shift to happen. Anyways, they are jumping into the storm, we could say. We need to study it on a much larger way, but anyways, that. So let's just look at FHCi, and we're going to go through a few of these things and some action items that you need to be involved in. Looking at our membership platform, FDA issues, our basic program, and some of the research, the CV research, and the future for FHCi and HP. So we've developed a private membership platform of our supervisors, family members. Reasons being is in not every state is there a health freedom law like Minnesota. There is no actual licensure or avenue to practice legally for homeopaths. So our practitioners are a member. Also, nosodes are classed by the FDA as a legend drug, which requires a medical license to prescribe. And we don't have medical licenses. Our practitioners register with us, and we register with the pharmacy. Our pharmacy operates on a membership platform, and so we don't actually need a prescription to order from the pharmacy because we're private members. So we also created the platform to generate the fuel for expanding the network, and we want to hear back from you about how it's going with your families or speaking out in the public. And we also have this looming threat of, mandatory vaccine laws and extensive government oversight, which we're still not sure how we're going to navigate through that. But so then what I want to talk about is the FDA. So we had, since 1929, the HPUS, Homeopathic Pharmacopoeia of the United States, 400.400, which had two separate classes of OTC products and nosodes, which are the prescription items. OTC is over the counter, so those are the belladonna and chamomilla you can buy at the store. In 2016, the FDA called this into review, and they spent a year looking at all the comments, and they proposed a draft guidance document, which had a number of comments. And initially, the draft guidance document was all just about OTC products. They withdrew that draft guidance document and created a new one, and that was published in October. And at that same time, they withdrew the HPUS. So the HPUS had classified nosodes as a separate line item within that. The second draft guidance document has no reference to nosodes, but what they're looking at is targeting manufacturers that are and remedies that are being sold or solicited to to families and young children, and also in relationship to infectious disease. So the next slide is about how you can submit comments. This still has a comment period there. The basics that we want you to say is to keep the existing 400.400, work with the homeopathic profession to ensure access to OCT products, And at this time, not to mention anything about nosodes, but that you really want to use homeopathy to protect your family. And where you're going to find out more is from Americans for Homeopathy Choice. This is their website. And the FDA, you can find links to get right onto the FDA page where you can submit your comments. And May 23rd is the deadline for that. So this is our basic program. For those who haven't seen it, this is actually our European program that has tuberculinum, but it has all of 8 other diseases. We've included streptococcinum in there, and that's for people who are not familiar with it. We want you to, for any further questions about the basic HP program, to look to our website. But I'm bringing this up here because our research was done on this level. So we published, there's 2 parts. The research was started in 2009 and closed in 2014, the entrance, and we tracked and followed these children. The research was assembled last year. Part 1 was published in December. That is factors contributing to the successful completion of sequential dosing of diseased nosodes. I'm not going to talk about that. Part 2 is due to be published this June. They're published in Similia Journal for Homeopathy, based out of Australia. We have a link on our website where you can find out more about it. Part 2 is safety of HP, review of immunological responses and effects on general health outcomes. So I'm just going to look at 2 tables, reason being because this is pertinent to the CV research, which is going to be the last part of the presentation. So there were a total number of 379 dosing series. So sometimes a triple dose, that's 1 dosing series. There were 4 dosing series in all if they did, and of every remedy. So not everybody did every remedy, and some people dropped out halfway through or the beginning or so on. But of all the dosing that we received on the paperwork that came in, there's certainly more doses given because there's a lot of people who didn't send us any paperwork. Number of individual doses, so that's 9,000 doses. The number of responses recorded. So individual doses means if you took 3 times in one day, that's 3 separate doses. Either way, the responses, the average number of responses was 15%, 597 total responses recorded. And then looking at the dosing schema, which was a 200C single, 200C triple, 10M triple, 10M triple. And this is again reported. So the number of series reported, so there were, let's see, total percentage. Yeah, total is 597. So there seemed to be more response with the triple dose of the 200C. And so not all dosing series were given. Some people just gave the single and not the triple. A lot didn't give all the 10M potencies, and so that's why we have less information there. Not all doses were documented. And even those who completed, 35 of the 126 who completed did not provide us a prophylaxis record, so we don't have any record of what they did either. So then looking at the responses, and I just want to bring this to bear because I know people who were new in the HP and then they took the remedy and then they started experiencing symptoms, and even though their practitioner said this was normal, we want to just tease out what it is. So with the pertussin, that was the first remedy given in the whole entire series of immune education. The ages were between 0 and 10 years of age. So some of them had previous vaccines and so on and so forth. The highest number of responses was with the single dose, but whereas with every other one, the highest number of responses was with the triple dose of the 200C. And as it goes down the list, you can see the responses are less. So the more and more educated the immune system is, the less and less of an immune response is generated. And it doesn't mean that there wasn't immune learning. It just means that the struggle piece about that learning wasn't there. So now we're just going to talk about the coronavirus. So we'll go back here. So if you've been scanning the internet and being overwhelmed with everything, then you will see that there's a lot of conflicting information. The first initial cases were drawn from the sputum of people in China, and they found a complex RNA strand in the sputum, and they said it's a virus. So there's a video, they're referenced here, with Dr. Andrew Kaufman, who says that actually when the body's under stress, it releases an exosome, which under electron microscopy looks pretty much exactly like the virus. And there's other pictures out there. And what this means is that when there's cell death, the body releases RNA. Is it a virus or not a virus? We don't know. Others have said this Prevotella bacteria increases Streptococcus bacteria. So if you have a high amount of Prevotella bacteria, that leads to pneumonia. And if you have this also upregulates streptococcal bacteria, which can go into blood clotting. And these are some of the symptoms we're seeing as effects in the coronavirus. And now they've found over 3,000 genetic variants to this RNA strand. And so the question becomes is this really an infectious disease? And some of the things that they're saying, as far as you can have it, you can pass it on, you can get it again, or you can have symptoms and no RNA, or you can have the virus and test antibodies but have no symptoms. It's debatable about whether this is a picture of that bacteria. So then what we're seeing from the symptom expression is there is a high amount of fear and anxiety and fear of survival. Some of the main symptoms we're seeing are the runny nose, sore throat, cough, difficulty breathing. Then the lungs can start filling with fluid, and there's a cellular situation where the cells aren't taking in the oxygen. You can also get internal bleeding and multiple organ system failure, death. And what we're seeing from the responses to the Nosode, so going back to that wave, is all of the HP supervisors took the remedies within the weeks prior to us establishing the research program. So we had already taken it on ourselves, and then you guys have taken it, and then, as you spread to your friends and family, we're doing that. What we're seeing is whatever the weak link in that person is, where this RNA strand and the immune system substances that the remedy's made from are activating the system towards expressing that weak link. And if we go back to the circle of the disease, and this is where you're going to work with your practitioners if you still have lingering symptoms, is what is that weak link? And what do we need to do to address that weak link? Like that. So our Nosode was sourced from China, sourced from the nasopharyngeal discharge in an active immune response, RNA confirmed with the cytokines, interleukins, and lymphokines, and lab verified, and then potentized according to HPUS standards. So our research project was to determine the safety, the effects. So safety is what is happening when you're taking it, the effects, more descriptive of that, and is it preventing disease expression? So for those who didn't take the research, but those who did, it's a review. There's an initial contact. You became a family member. We have our consent. Receive the remedy, take note of responses, contact the supervisor, and the follow-ups. So part of our inclusion-exclusion was to look at the health history and previous vaccination and the family's health status. And what we are aware of is that all the children and the families that have chosen HP are much healthier upon entrance to this study than the children who have had previous vaccinations. And that's an invitation for those families to look at vaccinations and work with their practitioner to try to help build their children's immune systems. We don't have data yet on how they're responding to, or we haven't analyzed, we just put this together, of how they're responding to the HP. But looking at herd immunity, natural immunity, and expanding awareness. So mitigating responses, your supervisor will have told you this. After the first dose, if there's mild symptoms, you just wait. If there's moderate symptoms, you would repeat a dry dose. There are some that are still in process, so this is here for them. If there's intense symptoms, repeat 3 pellets in water and sip every 10 minutes or hour or 3 times a day, depending. This is when you're talking with your supervisor. And the same would be with, you would still, even if you took extra doses, continue with the triple dose and follow the same pattern. And if these symptoms are continuing, then you work with the practitioner. And there is the availability for those who want to step it up and take the 10M. Contact your supervisors. They will be able to provide that to you. Again, there will be immune response, and again, we do want to track this on our records. So here's just a little look at the reason why I personally don't believe it's a true infectious disease, because there are homeopaths around the world trying to come up with the genus Epidemicus, and there's a number of remedies that are working for a number of people. These remedies are not necessarily related. And again, you would want to work with your supervisor if you're going to go this way too. So our follow-up questions are asking, we also have a question about testing, and that we're going to open it up to questions. There's one more slide after this just on the numbers, which I'll get to before I take the questions. We have the rapid test, which tests for the RNA sequence. We have an 80% false positive on that. What does that mean? There's the COVID antibody test. It supposedly is asking whether you had the disease or if you're immune. But not everybody is making antibodies, even though they had the disease, because that's a general immune response. Both tests are giving false positives and false negatives. And that's relating with the general immune response versus the antibody response. Then also, once you're tested, what does that mean as far as confidentiality and vaccine mandates? The link has been emailed to you by FHCi and your supervisor. If you do not have the link, please reach out to do that. Or if you're still in process, keep track of that email. And we are looking at, because we didn't do any before testing with this, we put our program together pretty quickly. We are doing a small sample size in Michigan, opening in May, so it's going to be only for residents of Michigan. We have a lab to work with, and insurance will cover that, and we have some supervisors in Michigan, so that's out there. If you have friends and family, our supervisors are listed on our website like that. So just the initial results, we had 1,097 individuals sign up. 400 have given us the 2-week response yet. The number of doses given theoretically is 800. So, but not, some people have taken a triple dose, some people have taken extra doses. Not everybody has taken the second dose. Number of suspected cases or presenting symptoms upon registration was 20. Number of suspected cases after dosing means they took the remedy and they have symptoms like the disease, and maybe it's a disease. We will be following up on all of this. A number with resolved symptoms means that they had some symptoms. They don't know if it was COVID or not. After the first dose, 5 had resolved, so 5 of the 20. After the second dose, and I wasn't able to check whether it was the same person, we was just, the numbers were just coming in. But 3 had resolved symptoms after the second dose, so potentially they developed more symptoms along the way between the first and the second. More details to come. The number of responses after dosing is 95 to the first dose and 97 to the second dose, and some of these may be the same people and some of them may be different people. And so if there were 495, it's actually, so it would be 25% of 400 people responded, or 13% of the number of doses given, there was responses. So questions on that?
So we had a question that somebody was saying that why are we not sure that this is a virus? And then so if somebody were to, the study's closed, we don't have to elaborate on it at some point, but if somebody were to sometimes receive and part of taking Nosode, does everybody get the same thing?
Yep, everybody got the same thing. There is no blinding and no control in this. So no sugar pellets were given. Everybody got the Nosode because it's unethical in all infectious disease research to do that. And even in vaccine research, they don't do that either. So what was the first question, Ursula?
How can,
Oh, yes. Yep.
that it's a virus?
Oh, and then there was one other question in there for, so we've closed the research because we as the FHCi want to move on to the next step. We can't take any more data coming in, but the platform is still open. So if you have friends and family, reach out to the supervisor that you want to refer them to, and the supervisor can still register people and still go through a similar process and provide the Nosode. And we will hold that data in a second base and maybe if needed refer to it, but for right now we're just going to keep with that. And I'm sorry again, Ursula, how do we not know it's a virus? Yeah.
Okay, well, so how do we know whether it is a virus or isn't? And then if it's not a virus, how can HP work if it's a system to educate towards viruses?
Well, it's not a system to educate towards viruses. It's a system to educate towards that RNA strand that the body is releasing, whether it's under stress or is a virus. So there is a potential model of infectious disease that actually the contagion is more of a magnetic situation as opposed to an infectious agent situation. It's like you will get sick if you've overrun your system and your body starts emitting a DNA or an RNA fragment when your system is overwhelmed. And that detox or elimination process is hopefully there to rectify the imbalance within the individual. In homeopathy, it doesn't matter whether it is called an infectious agent, whether it's a virus, whether it's a bacteria. We treat based on symptoms, what your body's doing in response to what's ever happening. It's like streptococcus. Streptococcus is a normal bacteria in the body. The idea of a streptococcal infection means that right now your immune system is not regulating that normal streptococcal bacteria. We can never get rid of streptococcal bacteria, or if we do, we end up with high Prevotella, that bacteria, but high Candida, high other dysbiosis, and so on and so forth. So it's about, first of all, what we're doing with the Nosode is creating harmony in the body. And some of the responses that we've seen coming in is maybe initial symptoms, but then later less fear, feeling stronger, feeling invincible. So there's some reconciliation that's happened in the individual, because right now we're under a kind of global attack. So our human system is fragile to the environment, to the toxins in our food, to allopathic medicine, and to governments that are, terrorizing us, and all of these things, and to our own delusions about what we think is happening or not, which might drive us to suicide or, medicating with drugs or all these different things. Is what is that human susceptibility? And that is what the Novus CV remedy is addressing. And that's what we're hoping to resolve. So I just have 2 more slides here, and then we'll take the...
There was one more question.
Okay, please.
Is the Nosode recommended for people that are immunocompromised?
So initially in our inclusion exclusion, we only wanted healthy people, but we don't want to deny people who are ill. So, but then there needs to be, and the supervisors will work through every family on this risk-based assessment. What is the risk factors to contributing to the disease, i.e. what is the potential of exposure? And then what are the risk factors of that individual's health? Once exposed, could that health of that individual actually manage the immune process of the disease? And then the same with the Nosode. So we are, one of our goals is the safety, right? So far, being what we would call principal investigator, overseeing the supervisors, we haven't had any critical hospitalization cases so far. We've had some people with previous conditions that have developed some symptoms that take some time to work through. But the majority of responses are mild and short-lived, and the healthier the person is, the least number of responses that they're getting. So the risk factors are going to be, you would need to work with a practitioner. There are some homeopaths that are distributing the remedy without the supervision of a practitioner. We do not recommend that. That's why we set up FHCi the way we have it, so that you always have somebody to work with to help mitigate what's going on and support the immune system. So we ideally want to move through that circle of disease process, which the Nosode itself could potentially do, or supportive remedies along the way like that.
Somebody wanted to know if they wanted to join the Michigan study, should they get their antibody testing done before, and if they think they might be having, should they wait and contact somebody in Michigan?
Yes, so we're...
Communicated with her, but if you want to go more into just antibodies in general, I think that would be really helpful.
Yes, for the discussion. Okay, so in order to do an efficient study, everybody needs to be tested through the same facility. And right now, facilities are just getting stocked up with their kits. And it also needs to be a facility that is getting kits that are CDC and FDA approved. And why we chose Michigan, because there's a lot of active cases there, and we have a number of supervisors, and we also have a clinic that's willing to work with us. So we still are fleshing out the details. We don't have exactly all the details yet. Now, the testing, we want to do testing before taking the HP Nosode, one, to see if there was already pre-exposure. And maybe there's no history, but there is positive. The second is that if it's showing negative, is the HP Nosode actually developing antibodies? And this has been one of the biggest glitches for our general HP program, particularly in states where there's mandatory vaccines. And it used to be that if you could prove you had antibodies, then you could not get the vaccines. But the New York law, they made it so even if you have antibodies, you're still going to get the vaccines. So that is something. And what we can say about the immune system is you can be immune and not have antibodies. We know this in homeopathy. You can also have antibodies and not be immune. So people who have taken the MMR vaccine, may have elevated antibodies, but they can still contract the disease and get the full disease process. So part of the reason we're doing this before and after study, oh, just to finish, that the HP program itself is stimulating immune response, general immune response. Like in the Cuba study where they tested in mice, no antibodies were produced because it's a macrophage action that was activated, which is the eliminatory response. So we're just doing it to provide some data, which will probably just ask more questions than give answers to it. But because the way this is, is it an infectious disease or a biome issue or whatever, we're not even trying to debate that. We're just saying, are we seeing improved health outcomes after doing the HP Nosode, and is it safe to do like that? Hopefully I got everybody. So I'm just going to finish up. I'm looking at the time. So economics of research, we're very happy. We gained 205 new family members, which generated $7,175. Extra donations, certain families had donated, 39 families of the 205, well, no, because some of our existing family members didn't pay that initial, so we did get an extra 1,900. What we're estimating our cost for doing the research is the administration and the analysis part, and then also completion of our private membership puts us at a net. We're still looking for close to $10,000 to really do everything that we want to do with this research. So there's a couple different ways you can donate. If you are not shopping on Amazon Smile, next time you do, just Google Amazon Smile. It says pick your charity. You can search for FHCi. And anytime you purchase, that is a passive way that we generate income. The money will go to FHCi, or you can find us on PayPal Charities, or we have various buttons on our website. And if you want to mail in checks, we are open to taking checks. Just put your email address in there. So I want to just end here. We'll have one last chance for a few more questions after this slide. We did a strategic plan last fall, and we looked towards what does 2020 look like. We were not planning on a pandemic, but our outreach has actually worked amazingly in this process. So here we are in the middle, and we've been heavily working. This is the board, and then we've been working with our supervisors, and then our supervisors have been reaching with other homeopaths, and then we're reaching out into communities, and then they're talking with friends and family, and there's different groups that are looking for something and they haven't yet connected with us. Some of the language you're going to find on our website. We have all kinds of blogs and videos and things like that. We are pro-infectious disease prevention. We are not anti-vaxxers. We are pro-immune education. So what is that in relationship to infectious disease, and helping to support healthy childhood and immune system development. We are building our community through our administration, which we have also, as our community gets bigger, our administration needs to get larger and larger, and we're just trying to manage it on the inside. And we're looking for local hubs of people that will begin discussion groups, living room chats. We have a lot of data on our website how to reach further out into the community, and at the same time keep us safe, because given that nosodes are classed as legend drugs and they're wanting to knock them off of the FDA registry, and this is why we have our private membership platform, and this is why all of your data is private and not being released to any government body, is how do we expand our knowledge and keep us safe at the same time. And so it's this continual process of expansion and checking that expansion, maybe contracting, and then building out more. If you need to communicate with FHCi, this is the email. that you would use, and we are looking at developing a private forum for our family members of how to communicate with each other, ask questions about HP, and we still have a lot of work to do. So that's our outreach. So any last questions that we have here?
There was one last question about should the CB Nosode be repeated every year, like for instance, is done with the seasonal flu?
Yes. So how long does the immune system response last? If we call it immune system education, like, you know, you learn to ride a bicycle, and pretty much if you wait 10 years, you get on a bicycle, you should be pretty good. If you wait 20 years, you might be a little shaky and you might want to just go a little slowly. With the influenzainum, we haven't yet done research on that to see, but there are some people that will take it 1 year and then the next year they're like, well, I just don't feel like I need it this year. So is COVID going to be a come and go situation like SARS and MERS was? We don't know. It is potential. You have enough in the vial, you can take it again. And even if you're feeling like your system is getting wore down, especially with the onslaught of all the other things that are driving the fear in this external world we're living, you can take it again. I don't think there's any harm, or my own experience is that the more you take it, the better you're going to be. There's once you move through those initial immune responses and the harder you worked, it means that you actually did do some deep working there. You probably won't get it again or have that experience again. Other questions?
And I believe from one of our supervisors was more of an admin question of the PMA documents. I'm assuming she has amended the family membership. So if somebody just joined us for the COVID research, would they have to rejoin for family member if they wanted to be in the regular program?
Nope, they're already a family member. So when they register with their HP supervisor, their supervisor will have record that they did the family membership, and so yeah, and if there's difficulty in finding that information out, FHCi has that information too, so we can work that out.
Okay.
Yes?
Yeah, my question was about the $6,000 on your chart for the PMA document.
Yeah.
The PMA had already been set up, so was there something special that was done just for this research?
Nope. Yeah, Ruth, we'll talk about that after, but so right now, we are operating as if we're a PMA. The completion of that process still needs to happen. So, yeah.
Thank you.
Yeah.
And then one last question, Kate, can you go more into antibodies, what they represent, and would it be beneficial for someone who's done the HP dosing to test for antibodies?
Yep. So when you have, so there's two parts of the immune system, right? The T1 and T2. So T1 is activating the fever, localization, inflammation, and discharge. So all that can happen through macrophages. They're little cells that will go along and gobble up. They gobble up damaged cells. They gobble up foreign bacteria. They gobble up, virus particles and so on and so forth. And then that green snot or the diarrhea that you have is loaded with those macrophages as you're discharging. And so the pustules of chickenpox, it's the same thing. Those pustules are the macrophages that have gone around and gobbled up the viral particles and the antibodies. So what the fever will do is activate cytokines that activate the B cells and the cells, the lymphocytes that make antibodies. An antibody is like a prong that will combine with the antigen. And so that pustule that's in the chickenpox is an antibody antigen complex. And in some instances, you need to develop antibodies in order to rid yourself of the disease. So in measles, the reason why they wait until the child is 1.5 years and now they're giving it at 1 year of age is because the immune system doesn't yet have the capacity to make the disease-specific antibody to measles until between 13 and 15 months of age or 18 months of age. So that there's certain maturity of the machinery to develop those antibodies. Whereas you can have general antibodies that will just kind of climb onto whatever. So the disease-specific antibodies. So there's still the science on COVID is not done all the way yet. Every country has a different thing going on. And so the drawback for getting testing is that there's false positives and false negatives. You're also cataloged in the system. If, whatever the proposed idea of vaccines coming, if you drew a negative once, does that mean you have to get the vaccine? Or there's so many questions that we have to ask here. And really the biggest questions is, do we have autonomy of our own body? And do we have confidence of our own immune system to defend our right to survival? Because that's actually what the immune system does. So before asking the question about whether to get antibody testing is just asking, how much do you want to go down that road? Or, what are you going to do with the information, whether it's positive or negative, or what are other people going to do with the information too? So that's, yeah. Hopefully that answered. Any other questions?
Is this going to be made available on replay?
It will be made into a recording and sent out to all the members of FHCi.
Thank you.
Yep, and the PowerPoint will be available as well too. Sarah or Ursula, anything else?
That's it.
I wanted to add something on this point.
Okay, good.
This is the pneumonia problem for recruiters in the state of Hawaii. Both doctors use homeopathic for very years, and that is very successful. 201 cases, and 1,521 cases, reported cases. And this book has 60 remedies. It's a small book, very well written.
What book is it?
It's leaders, homeopathic leaders in pneumonia.
Oh, homeopathic. Okay.
But I pulled forward both doctors. So on the list of Julie Winston, list and academic list, I want to tell you that homeopathic medicine
Mm-hmm. Yeah. Yes. Yes. Well, thank you for sharing that, and we will also reference that in the newsletter as we go out. Okay, so I just want to say thank you, everybody, for being with us and participating. And I think from Dr. Masood's comments there about homeopathy is, as you're entering into the world of homeopathy, there is so much yet to be revealed about the strengths of homeopathy. And there is an uphill battle to protect homeopathy from being annihilated from, you know, other agendas. And it's time to be brave and to just keep talking and keep learning. There's so many books out there. Anyways, thank you so much for being with us today. And we'll look forward to working with you in the future. Thanks.